The topic for today is cryosurgery. Now, this cryosurgery is also known as cryoablation or cryoablative therapy. Now, you do know that whenever there's a thermal damage to the tissue, for example, a person has sustained burns, so this will cause a destruction of the cell. Because heat can cause destruction of tissues, thermal ablative therapy is very devised. Radiofrequency ablation or laser therapy. So these work on the principle where they generate heat and that will destroy the tissue. Now, if heat can destroy a tissue, cold can also destroy tissue. So when most of the cells in the body, when they're exposed to less than minus 40 degrees Celsius, they sustain injury. Now, this is somewhat similar to what happens during frostbite. So if you remember in the class of frostbite, we discussed that extreme cold temperatures, when a cell is exposed to such extreme cold temperatures, significant amount of damage happens. Now, what happens in cryoablation is that we utilize that phenomena and we subject a tissue. Example, if there's a tumor or a skin, we insert a probe into this tumor and we subject this tumor to extreme cold temperature. Right? Most of the times it is less than minus 40 degrees Celsius. When you subject this to extreme cold temperature, just like in frostbite, there is some damage that happens to these cells. But the interesting thing is, you might know that every ischemia, once it resolves with perfusion, there is ischemia reperfusion syndrome. Similarly, when the patient has been underfed for a long period of time and you overfeed them, there is a risk of refeeding syndrome. So, just like there is reperfusion injury, there is refeeding injury, there is also rewarming injury. Now, in cryoablation, it is not just that we subject a tissue to extreme cold temperature and destroy it. We subject this tissue to extreme cold, thereby freezing it. But we immediately reheat the tissue. We warm the tissue, which is called as thawing. Now, this warming will exponentially increase the damage that happens to the cell. And this is not just in one cycle. We freeze and we thaw. Then again, we freeze it, we thaw it, we freeze it, we thaw it. So, multiple cycles of freeze thaw phenomena happens, which damages the cell to a great extent, and thereby we get the effects. So, that's what happens in cryoablation. Cryoablation or cryosurgery is not just subjecting a tissue to extreme cold temperature, but in fact, it is followed by reheating the tissue, and this cycle happens over multiple times so that the desired effect is obtained. What are the applications of this cryosurgery, or what are the indications? Now, this is mostly used for skin tumors or skin lesions, but can also be used for soft tissue lesions and also for internal cancers. So it can be used for oral cavity tumors, for lung tumors, for liver tumors, for prostate tumors, and for cervical tumors. For all these tumors, cryoablative therapies can be used. In soft tissues, it can be used to treat fibromas and plantar fasciitis if it is not responding to the conventional therapies. Skin, it can be for benign conditions, which is the most common indications, but it can also be used for malignant conditions. So, malignant conditions would be low grade tumors, low grade squamous cell carcinoma, and a low grade basal cell carcinoma. Benign skin conditions like acne, warts, molluscum contagiosum, pyoderma gangrenosum, pyogenic granuloma, even hemangiomas. All these are the conditions where cryotherapy can be applied. Now, how to do it? Like, if there's a cell, you need to freeze this cell Then again, you need to heat this cell. So how to do it? Now there is something called as Joule-Thomson effect. Now, you do know that a material, a substance can exist in the form of solid or liquid or a gas, depending upon the distance between these molecules. If the molecules are very close to each other, tightly packed, it becomes a solid. A little far away from each other, it becomes a liquid. And in gases, the molecules are very far away from each other. Now, when you want to bring these molecules together, it means you need to compress this gas. So, when you need to compress this gas, it depends upon two factors. One is pressure, other is temperature. So, when you apply a lot of pressure, you can bring these molecules closer. Similarly, when the temperature reduces, the molecules can be brought together. So, when you heat something, for example, if you keep a boiling water, you can see there is convection. So, the molecules are trying to move away from each other. So, a high temperature makes the molecule to move away from each other, and a high pressure makes the molecules to come towards each other. So, you take a gas, for example, you take an argon gas and you take a canister. You put all of this argon gas into this canister. Now, this is under high pressure. So, there's a high pressure argon gas stored in a spray canister. Now, if you release this knob, as soon as you release this knob, this argon escapes out of the gas and comes outside. In the outside, there is not as much pressure as there is. So it is a high pressure area, and compared to this is atmosphere is a very low pressure area. So as soon as it comes out, it expands like anything. Now, most of the gases, when they come out of high pressure, when they get relieved from that pressure, when they expand, this expansion cools those gases. So the gases lose their temperature and they cool, and whatever is in contact with them or whatever is in surrounding of them, so in the surrounding environment and that in contact with it also cool. So much so that they become sub-zero temperature and it freezes it. Right? So this is what happens. This is called as Joule-Thomson effect. So Joule-Thomson effect is when you store a gas under high pressure and you release this gas comes out, this compressed gas now expands, and when it rapidly expands, it loses temperature, it cools down. As it cools down, it also causes the surrounding structures and the that which is in contact with it or which is nearby it also freezes. So this is called Joule-Thomson effect. Most of the gases like nitrogen, carbon dioxide, argon, all of this cool down, lose the temperature, freeze the surrounding tissues when they come out of high pressure area. But certain gases like hydrogen, helium, these gases, if the same principle is applied, the same experiment is done on these gases, as soon as they come out of this high pressure, they heat up. So these gases, they increase their temperature. This is what is used in cryoablation. Now, if we can get a probe and we can place this probe onto the tumor. And through this probe, initially you send an argon gas. From the high pressure you release, that will freeze this probe and it will freeze the tissue also. Sorry. Now, through the same probe, you pass a helium gas. Now, this helium, as it exits this high pressure system, it heats up and it thaws the tissue now. Now, this is done for multiple times so that the tissue undergoes freezing, thawing, ultimately leading to the death of the tissue. Right. So, what are the cryogens that are used? The substance which can freeze this is called as a cryogen. So, liquid nitrogen can be used, carbon dioxide can be used, argon can be used, or freeze sprays are available. So, any of these can be used. Now, liquid nitrogen, apart from it can be used in the form of a cryoprobe, as we discussed now, or a liquid nitrogen can be taken and a cotton stick, a earbud, or a cotton applicator is taken. It is dipped into it and it is applied onto the tissue directly. Right? For example, there is a wart. You can take a cotton stick, you dip it into the liquid nitrogen, and then you apply it onto the surface of the wart itself. Right? So Can be applied by a cotton applicate, or it can be used in the form of a spray. Right? So it is taken, it is compressed into a canister, then it is held at 10 to 15 centimeter from the lesion and it is sprayed over. So it can be used in the form of a cotton applicator or by a spray or using a cryoprobe. Now, carbon dioxide can also be used as a spray. It can also be used as a snow, or this carbon dioxide and acetone can be mixed, and that is used in the form of a slush. It can be used in the form of a spray, snow, or slush. These free sprays contain a pre-mixture of dimethyl ether and propane. So these are also stored under high pressure. When you release them, they lose the temperature and they freeze. Right? So now how to go about it? Mechanism of action. So for example, if there is a lesion here, this is the skin, and over the lesion, you need to treat this lesion. So insert a probe into this lesion. This probe has a needle and then it has a chamber. And inside this chamber, there is a high pressure system. There is one more chamber which has a high pressure system with a valve. Now, into this high pressure system, first you send the argon gas. Now, the argon gas is under high pressure system here. As soon as you open this valve, the argon gas will come here. And as soon as the argon gas comes here from the high pressure system, it has been relieved from the pressure. It rapidly expands. And as it expands, it will freeze this probe. It will cool down this probe. As the probe is directly in contact with the tissue, this tissue also freezes. Right? And then as it rapidly expands, this gas will come out through here. Now the freezing stage is done. Now through this we send the helium gas, which is under high pressure. Once you open this, the helium gas will come out of here and it expands. When it expands, because of its nature, as I told earlier, it heats the probe. The probe is heated now, and the tissue that was frozen is thawed. Okay? Thawing happens, and then it escapes. Then again we send argon gas, and then again we send helium, and this process is repeated. That's how it happens. Now, what actually happens when you freeze the tissue? Why would freezing a tissue cause death of the tissue? So now, whenever a tissue is frozen, now this can cause direct cellular injury. Also, it can cause indirect cellular injury. So first, we'll discuss about direct cellular injury. What happens? So this is a cell here, and there is a blood vessel here. Right? So whatever the fluid is there, this is a intravascular fluid, and this is a interstitial fluid, and then this is intracellular fluid. Right? So these two together are extracellular fluid. So this is ACF and this is intracellular fluid. Now, when you freeze this tissue, whatever the fluid is present in the extracellular space, because of the sub-zero degree temperature, this becomes converted into ice crystals. Now, these ice crystals are formed from the water of the ECF. Whatever the water is there in the ECF, that gets sequestered and it forms an ice crystal. Now, when it becomes an ice crystal, because the amount of free water in the extracellular fluid reduces, and because the free water reduces, it becomes hypertonic. It's simple. Because the solute concentration relatively increases, the fluid concentration is reduced. Although it is there in the form of ice, it does not contribute to the fluid. So that is why the fluid amount reduces, the fluid volume reduces, and this solution becomes hypertonic. And as this solution becomes hypertonic compared to that of ICF, you do know that the water moves from a lower osmolarity area to the higher osmolarity area. So it will draw all the fluid out of this ICF into the extracellular space. So as a result, now this cell dehydrates. This cell undergoes dehydration and this cell shrinks. But you do understand that even intracellular space is filled with fluid, and this also leads to the formation of a ice crystal. As the intracellular ice crystals form, these intracellular ice crystals have two effects. One is it will damage the membranes. Now, these membranes could be a organelle membrane. So these are the intracellular cytoplasmic organelles, and the organelle membranes are damaged. And second is it could damage the plasma membrane. Now, when it damages the plasma membrane, it will lead to the formation of the pores. So small pores develop here, and these pores are initially small, and they will start to leak the electrolytes. As electrolytes leak, these electrolytes are the ones which are responsible for maintaining charge. The cell will lose the electrochemical gradient, right? So the cell loses electrochemical gradient. And when the pores become enlarged, multiple pores coalesce together and form a big pore that will lead to the loss of solute also. So all the intracellular components, they come out and they enter into the extracellular space, right? So this is what happens when you subject a cell to a sub-zero temperature. There is ice crystal formation, which happens both intracellularly and extracellularly. Because ice crystals form in the extracellular fluid, the all the fluid in the extracellular space is sequestered into this ice, and the net amount of the fluid in the ECF space becomes lesser, so it becomes a hypertonic solution. And as water moves from a lower osmolality to a higher osmolality, all the fluid, most of the fluid from the ICF is drawn into the ECF. This causes dehydration of the cell and shrinkage of the cell. But ice crystals formation can also happen intracellularly, and these intracellular ice crystals cause greater damage to the organelles of the cell, also to the plasma membrane of the cell, leading to the formation of pores. These pores, when smaller, lead to loss of electrolytes, and thereby electrochemical gradient is lost. And when these pores become larger, they coalesce together and they lead to the loss of solute also. But now, what you need to observe is, if this is a cell and there is IC crystal formation is happening, and EC crystal formation is also happening. Now the amount of IC crystal formation depends upon the time which it takes to form crystal, right? So for example, if the cell freezes rapidly, if there's a rapid frozen happening, so if the cell freezes rapidly, then the intracellular ice formation will be more rapid. So when this happens, for example, if there is in the intracellular fluid, there is 10 ml of fluid is present. Think that there's a 10 ml of fluid is present in the cell. Now, when the freezing takes time, because extracellular ice formation is already happening, some 5 ml of fluid will get out because of the osmotic gradient, and 5 ml remains inside, and this 5 ml will lead to the formation of the ice. So the ice formed would be around 5 ml. But if there is a rapid freezing, then even before the fluid can get out, only 1 to 2 ml of the fluid is getting out. But even before it can get out, 8 to 9 ml of the ice fluid in the cell has converted into ice, right? So if there is rapid cooling happening, more of the fluid intracellularly gets converted into the ice even before it has a chance to get out of the cell, and that causes more damage. So those cryoprobes in which rapid cooling happens, such cryoprobes lead to such cryogens when used lead to greater amount of intracellular ice formation, and greater will be the cell damage that happens. Right. So this is what happens in a freezing section. And then in the second stage, you thaw it. So when the cell is rewound, what happens? When the cell is rewound, whatever the extracellular ice crystal was there, this extracellular ice crystal will now break down, and it will lead to the formation of a fluid. Now, initially, if there was 10 ml of fluid outside the cell, of this 8 ml got converted into the ice, and this led it to become hypertonic, which took around 5 ml of fluid, right? So now 5 ml plus 2 ml, 7 ml of fluid is remaining outside. Now what happens? Because the extracellular ice crystals, they dissolve, they warm, and they get converted into a fluid. To this 7 ml, around 8 ml of this gets converted back, and about 13 ml of fluid will be there. So initial fluid was 10 ml. Now because of this contribution from the intracellular fluid, the fluid has become 13 ml now. So all this ice crystal, when this breaks down into the fluid, it adds more and more fluid to the extracellular space, and that's why this fluid becomes hypotonic. Right? So when this becomes hypotonic, now you can understand that all the fluid will rush back inside. So when this rushes back inside, this will make the cell to swell now. And when this cell swells, this will burst out. And this leads to cell lysis. Simple. So if I want to summarize it, in freezing stage, the extracellular ice crystal is formed, which makes the extracellular fluid hypertonic. All the fluid comes out and dehydrates the cell. In thawing stage, the extracellular ice gets warmed and converts into the fluid. The extracellular fluid becomes hypotonic. All the fluid will now rush back into the cell, and the cell swells and it bursts, and there is cell lysis that happens. But the intracellular ice also melts, right? But the thing is, the rate of melting of extracellular ice is much, much higher than the rate of melting of intracellular ice, right? So as you start rewarming, the extracellular ice melts faster, and as it melts faster, the extracellular fluid becomes more and more hypotonic, and this fluid enters inside. As the fluid enters inside, intracellularly, still the temperature is very less, and it is still leading to the formation of a ice, right? So whatever the fluid has entered inside, it is still forming ice, right? So it means that at a moment when you are rewarming, when the extracellular ice is being broken down into the fluid, there is still intracellular ice formation going on, and whatever the fluid that has been coming from out of the cell into the cell is contributing to this ice formation, and these ice crystals increase in number intracellularly, and more damage to the cell happens, right? So cell damage is also because of the damage to the organelle, and this is how a cell dies. But you see that there is a tissue here, and our probe is here at the center. Now, those cells, even if you look at a thermal injury, what happens in thermal injury? The maximum damage is at the center, which is called a zone of necrosis. Then it is surrounded by zone of stasis, where there is a little damage. Then it is surrounded by zone of hyperemia. Right. So similarly, those cells which are at the center, they get dehydrated. In next stage, they get swollen, they die. But those cells which are still at periphery, here there is only cell membrane damage, but the plasma membrane has not yet been damaged. So what happens to those cells? The ice crystal formation is not so much that it can cause the immediate cell death. Now what happens in those cells is, as intracellular ice crystal has formed, now this intracellular ice crystal, if it cannot damage the plasma membrane, it still has the capacity to damage mitochondrial membrane. And as soon as it causes damage to the mitochondrial membrane, there is release of caspases. Now these caspases will trigger apoptosis, and a cell is lost. The cell dies by apoptosis. So this is what happens. So either the cell directly dies because of swelling and bursting of the cell. If there is no plasma membrane damage, still there can be mitochondrial damage which releases capsules, and that causes the destruction of the cell by apoptosis. Right? So these are all the direct injury that happens to a cell. Now what happens to indirect injury? So when it comes to indirect injury, so if this is a tumor and you have placed a probe, now this tumor does not just contain cell, it also contains blood vessels. There is a cell here, and close to the cell, there is a blood vessel. Now, if ice crystal can form intracellularly, if ice crystal can form in the interstitial space, the ice crystal can also form in the blood vessels. So there is an intravascular ice crystal formation, and this intravascular ice crystal will cause the destruction of the vascular endothelium. right? Vascular endothelium now gets destroyed. And when you heat it, this ice will melt off and this ice moves forward, right? So the ice has melt off, it has gotten converted into a liquid and it has moved forward. But what happens to the damaged endothelium? Right? So if you know from the class of wound healing, so whenever the endothelium gets damaged here, now as the platelets and RBCs are going inside, this damaged endothelium attracts the platelets. The platelets come here, the platelets get attracted to this damaged endothelium, and these platelets get activated. So once there is activation of these platelets, they release alpha granules and dense bodies. So alpha granules contain all the growth factors, dense body contains serotonin. So these together will elicit the inflammation. So whenever there is inflammation, this will cause the recruitment of neutrophils, monocytes, which get converted into monocytes get converted into macrophages. They act onto the blood vessel wall and they cause the increased vascular permeability. So when increased vascular permeability happens, when there is increased vascular permeability, all the fluid will come outside the cell. It gets collected in the extracellular space and it will cause tissue edema. Tissue edema causes hypoxia. And then you know the story from the hypoxia. Right? So this is the indirect damage that happens. So whenever you freeze and thaw for one cycle, all these things happen. So you keep doing freezing, thawing for multiple sessions. This just gets escalated and exponentially damages the tissue. Now, what are the advantages of this over thermal ablation? The first most important advantage is you can monitor this. So, when you burn a tissue, it causes coagulation of the proteins and it just evaporates, and you cannot see how much of the tissue is coagulated. Right? But here, when you freeze it, it leads to the formation of an ice ball, and this ice ball can be visualized on ultrasound or on CT or on MR, right? So you can monitor the extent of damage because you can visualize this ice ball formation on investigation, on radiological investigations. Plus, you can also get a MR thermography to see the temperature changes. And because this is only mechanical, no electronics involved, you can do it under guidance. So you can do it under guidance of CT or MR. To do a radiofrequency ablation, the only thing you can use is a ultrasound guide. But here, because it is not electronic, it is just mechanical, and there is no involvement of electronics here, you can do it fearlessly under the CT or MR guidance. And because it is cold, this is anesthetic also. So the patient feels less pain. And because the patient feels less pain, this can be done on OPD basis also. And there is no need for general anesthesia. So these are all the various advantages of a cryotherapy. Now, what are the complications of this? When a large organ like liver is subjected to this ablation, that will result in the release of lot of inflammatory substances. And these inflammatory substances will lead to systemic inflammatory response syndrome, and that eventually gets converted into a state of shock, which is called as cryoshock. Right? So cryoshock usually happens when cryoablation is done to larger areas, larger tumors, so large organ tumors, where a lot of inflammation happens, and this will trigger the cysts, and the patients can go into hypotension, they can go into pulmonary edema, they can go into myocardial depression, or even they can go into disseminated intravascular coagulation. And the second thing is when you heat a tissue, you burn the tissue, the proteins get coagulated, and that will stop bleeding. But here, there is no coagulation of the proteins. You don't burn them, the risk of bleeding is higher. Also, when you freeze a tissue, the tissue becomes fragile. And when the tissue becomes fragile, even a slight movement of the probe can lead to fracture of the tissue. Right? The tissues get fractured and this will further enhance the bleeding. And fourth is it is cryoablation, the use of gases, the use of cryoprobes. It is comparatively costlier. So these are the complications or disadvantages of a cryosurgery or a thermal ablation. One more other advantage, better advantage of the cryoprobe compared to that of a radiofrequency ablation is that in radiofrequency ablation, if this is a tumor cell, you can use only one probe. Even if you use multiple probes, they have to be used sequentially one after the other. But the advantage in cryo is that you can use multiple probes and all of the probes can be used at a same time simultaneously, thereby saving time. Right? So this is in brief about cryosurgery or cryoablation.